What exactly is happening to our bodies as women as we go through menopause?
Right. Well, menopause is when you start losing our natural hormones. And these hormones keep our hair beautiful, and we're gentle and lovely, and we aren't depressed. We're really happy beings. Our bones are strong. And when we lose these hormones, a lot of symptoms, just like what you were saying, happens. And women become, it's kind of like a flower that's full of life, and it's strong, and it's getting watered, and as it ages, it starts to wilt. And that's really what happens in menopause. Women start to wilt and lose their real essence.
Awful. What an awful thing to hear.
Right?
Yeah, I know that estrogen, we all know you always talk, you hear people talk about estrogen is the main hormone that's disrupted during menopause.
That's right.
But there are other hormones as well, you say.
That's right. So estrogen and progesterone are the two major hormones, but then there's also testosterone. And what happens is when women go into menopause, a lot of the other hormones start to crash too, such as the thyroid and the adrenal hormones. These are very important for a woman's vitality.
Okay.
Well, a lot of women do hormone replacement.
Right.
Okay, I know that when my mother was going through menopause, the doctor was saying perhaps do hormone replacement, but it can also be very controversial because many studies have shown that hormone replacement is also linked to breast cancer.
Right.
So what do we do? Has that changed at all?
Right.
I am here to tell you that that is not true for the bioidentical natural hormones. So there's controversy in this field because they're the old hormones that our mother used to take,
Okay.
and those hormones were created from horse's urine.
Wait,
and
say that again?
They were created from a horse's urine, a pregnant horse at that.
Why would anyone think that's okay for women to put?
Well,
Yeah.
they were created 60 years ago, and we didn't have a clue really of how the body worked. There wasn't even a name called hormone in the medical literature. So they did the best they could, and those hormones are not identical to the current, to the hormones that women make. The new hormones are the bioidentical natural hormones, and we know so much more about how the body works. And those hormones go into the body, and they help to decrease the diseases of aging. So they decrease colon cancer and lung cancer by about 30%. They decrease 50% of heart disease, dementia.
What are bioidenticals exactly? Explain to me.
Okay,
so they're different from the other hormones.
The other hormones are 60 years old, they're archaic,
Okay.
and they're exactly the same hormones that women actually produce in their body. Exactly the same. There's not a single thing different.
Is there any risk of any sort of cancers with those?
So in my practice, and I have thousands and thousands of menopausal women, we decrease breast cancer by 60%. But the standard data with hundreds of thousands of women generally show there's no increased risk of breast cancer or decreased risk of breast cancer. And there's so many other benefits to the bioidenticals. Did you know that heart disease is the #1 killer in women?
Yeah.
Number
Yes,
one
that
killer.
is true.
And
Yes.
bioidenticals prevent 50% of death in women, and heart disease and high blood pressure and diabetes.
But you don't take these. Instead, you have a natural remedy.
No, I actually do.
She does.
And why I'm so
is so
thrilled
natural.
to be hearing what Dr. Hall is saying is that I've been taking bioidentical hormones, exactly, we were chatting before the segment, for a few years, and they are magical.
Who knew?
Absolutely magical. And I do that with a very natural program, as you know. I'm dairy-free, gluten-free, sugar-free, exercise, and meditate. And those are the things that I feel certainly have completely decreased the symptoms of perimenopause and menopause.
And you're so vegan, and your diet is so clean. I mean, if anyone is a great spokesperson, it's you. Because I would feel completely
I'll
safe
take
about that.
But what about weight gain, Dr. Hall? Do the hormones, the estrogen and progesterone, I'm assuming those are the two hormones we're talking about?
Those are the two major hormones.
Okay.
There are really 14 different hormones that we balance in menopause.
Okay.
Now,
For women who need them. Not everybody needs
Does
that
it
many.
cause weight gain or help with weight gain?
Oh, it helps with weight gain because women gain someplace between 20 to 40 pounds in menopause. But really, we're not just talking about symptoms. We're talking about how are we going to age for the rest of our life, for the next 50 years.
And feel great.
And feel great and avoid a lot of diseases and pharmaceutical medications that so many women are placed on. And I want more light and love coming through women. And you, the three of you, have so much beauty coming through you. And I want you to stay that way.
We want to.
Until 130.
Yeah, we really are.